My name is Lisa Jukes. I'm a gynecologist, board certified in obstetrics and gynecology, but have focused solely on gynecology since 2005 and take care of all ages starting in adolescence throughout a woman's life. For me as a gynecologist, I have always thought that women should have access to the most advanced technologies and the least invasive. My patients have tremendously benefited from the addition of Mona Lisa Touch. It's been, they will tell you, life-changing for some of them. However, there's a large population of patients that we aren't able to treat, and they have symptoms such as stress incontinence or decreased sensation within a course, or things just don't feel right. They've had a couple babies and they don't feel good about themselves, or even younger women that just feel like their anatomy doesn't look or feel the way it ought to. We had nothing for those patients other than doing surgery, which could be cosmetic surgery, which involves creating incisions that can cause pain and scarring. Votiva is unique that you can use the same handpiece to treat internally and externally. It was designed for that. And it is the only bipolar radiofrequency device out there and has the shortest treatment cycle over all the others. The FDA approval was one of the big decisions that I went with Votiva. It was important to me when I adopted Mona Lisa that they had clearance for treatment that was dedicated to women's health. Votiva is the only one that has FDA clearance for gynecologic use, sexual dysfunction, and urinary dysfunction. All the other devices were monopolar, which means the energy had to travel from one source to another. So the patients have to wear a grounding pad to prevent burns, and the energy could still travel in places you may not want it to. So the beauty of this device is it's bipolar, and the technology is contained with the actual handpiece. You don't have to wear a grounding pad, and it also has safety mechanisms in place to prevent you from over-treating somebody or under-treating somebody. And it takes a lot less time, which is good for you and the patient. Nobody wants to sit there any longer than they have to. So now treatments used to be 45 minutes. We're able to treat patients with the vaginal device for 10 minutes and have excellent treatments. And also excellent treatments with just the first. We don't recommend stopping with one, but even with that first treatment, they see a significant improvement. Votiva has a broader range of patients that you can service. Votiva allows you to treat even the younger women that may have labial hypertrophy or enlarged labia, stress incontinence, as we were talking about, and sexual dysfunction. So that covers a much broader range of ages.